Good evening and welcome to another edition of the Yuba City Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have a very interesting program for you tonight as we explore the facilities and functions of the Sutter County Health Department. We will also have the unique opportunity to meet with some of the health professionals who are charged with the responsibility of protecting the public health of our community. Tonight marks the beginning of the second year of the Medical Explorer programs. I'd like to take this opportunity to thank you, my viewers and fellow residents of the Yuba City area, for the support and loyalty that you have shown me as your Medical Explorer. I truly appreciate your very kind letters and words of support. Please keep in touch during the next several months. Before getting to our topic tonight, let's take a look at the latest medical news. Annual USA cancer deaths could be cut almost in half by the year 2000 if the latest treatments are used by every hospital and if 15 million people stop smoking, the director of the National Cancer Institute said recently. Dr. Vincent DeVita told the American Cancer Society that trends are so favorable that targets have been set. More than 50% of all cancer patients now survive at least 5 years. About 450,000 in the United States will die of cancer this year. Dr. DeVita sees the following goals to be achievable goals. The first one, saving 60,000 lives a year by speeding the latest treatment to every hospital. There is a 15% difference in survival rates between patients nationwide and those enrolled in tests with new cancer treatments. Saving 60,000 lives a year by keeping tabs on some 200,000 cancer patients who have been treated and presumed cured, but whose cancers may recur. About 20,000 are effectively saved by additional drug and radiation treatment to wipe out remaining cancer. Saving 75,000 lives a year by getting 15 million of the USA's 33 million smokers to stop smoking in the next 5 years. DeVita says that we are on the verge of a non-smoking epidemic. More people are beginning to realize that smoking is one of the worst things that you can do for yourself. My final medical news story tonight concerns some health benefits from eating candy. Everyone wants to hear that. Although dentists might object, a doctor reports that chewing gum or sucking on a piece of candy could reduce the discomfort of heartburn by increasing the flow of saliva, which neutralizes stomach acid that contributes to heartburn. A report in a recent issue of the New England Journal of Medicine states that saliva plays an important role in reducing the damage caused by stomach acids sloshing up into the lower part of the stomach and esophagus. Sucking on candy or chewing gum can increase the production of saliva 8 or 9 times. Now, on with the Medical Explorer. There are 2 major county agencies that serve to protect the health of the residents of the Marysville and Yuba City areas. The Sutter County Health Department, located 1 block away from the Fremont Medical Center, offers many services to the community, ranging from treatment of communicable diseases to the monitoring of the cleanliness and hygiene of local restaurants to offering immunizations to prevent dangerous diseases in children. Let's head over to Del Norte Avenue now and explore this modern county health agency. Hi.
Hi, Doctor.
Good to see you again.
Nice to see you.
I'm standing here with Alan Leavitt, the administrator of the Sutter County Health Department. Mr. Leavitt has arranged for us a very, very interesting tour of his facilities today. Thank you very much for letting us come over.
Thank you for giving us the time.
Let's begin by just having you summarize for us some of the activities that go on here at the Sutter County Health Department.
Okay, Sutter County Health Department is responsible for providing the basic public health services in Sutter County, which are preventive health services in nature.
So besides some of the clinic facilities, which we're going to see, you have some very important laboratory facilities as well.
We have a public health lab, which is responsible for doing all the testing to determine what diseases are prevalent in the community. And we have a nursing section, environmental health section, and clinic area.
I just noticed a lot of activity going on behind us over here. There seems to be a lot of medical records. What is this area right behind us?
Okay, the first area that you come into in the health department is the registration area, where a person would register or go for information what service they want to get. And beyond that is our medical records area, where we have some 20,000 medical records on file of different people.
Why don't we go down there and take a look?
Okay.
Great. Hi.
Hello.
How you doing?
Hello.
Well, obviously this is the medical record area.
This is our medical records area. As I said before, we have some 20,000 medical records. They are color-coded by the year and the patient's number. And pull one out so I can show you. We give each patient a number when they come in. It's by the year, and then we just assign a consecutive number. For instance, this patient was number 877 in 1983.
How would we distinguish a patient that might come here versus a patient that goes to the operating clinic that you have now, the Sutter County Clinic?
Okay, the outpatient clinic is designed to treat someone who is medically ill and sore throat, that type of thing. The health department, as we mentioned before, is for preventative health care. We have child health clinics, family planning clinic, and immunization clinic, that type of service.
You'd also be dealing with communicable diseases?
Communicable diseases.
Venereal diseases, sexually transmitted diseases.
Right. And we keep those records in a separate room.
Not even here?
Not even here.
Very good. It ensures confidentiality, I suppose.
Both ensure confidentiality, both sets of records.
Great.
And the records here, most medical records are kept as an individual file. We keep our medical records as a family file, so that if the mother comes in requesting information on one child, we can give it on 2 or 3 children if they're still in the family.
Great. Well, since we've started talking about the clinic and health care here, why don't we head over to the clinic now and see what it's like?
Okay.
Great.
Okay, this is our clinic area, and this is the area where we have the different children's clinics, family planning clinics, immunization clinics, and sexually transmitted disease clinics. And they're held different days of the week and on Tuesday nights. And this is one of our exam rooms where both our doctors and nurse practitioners perform their functions. This is Barbara Moberly, our director of nurses, who will tell us a little bit more about the nursing services that are offered at the Sutter County Health Department.
Well, I think Alan has told you a little bit about the clinic services that we offer. In addition to that, we do have field nurse services, which means that we have public health nurses that will go out to do education and liaison in the homes and help people get the kind of treatment they need in the home setting, and they coordinate with our clinic nurses very closely. In addition, we do some outlying clinics away from the health department that in our family, in our CHC, our well baby clinics that are done through the auspices of the health department but away from the site to make it more convenient for the public.
How many nurses do you actually have on your staff here?
We have a total of 12 people in our nursing services department. One of those is a Spanish-speaking community aide. So we actually have, between LVNs and RNs, we have a total, and nurse practitioners, we have a total of 11.
They're actually going to people's homes in the community?
Now, we have 3 nurses that go out to the home.
I see.
Only 3 field nurses. The rest of them work in the clinic.
Work here right in these examining rooms.
Mm-hmm.
So
That's
here
right.
you have venereal disease examinations going on.
That's correct.
Looking for gonorrhea,
Right.
syphilis, herpes.
Herpes,
Everyone always looks for herpes. You have the well baby clinics and things like that.
At Well Baby Clinic, we have family planning clinics. We have newborn infant clinics where we see the infants at 2 weeks of age and do a thorough checkup on the infant and do counseling with the mother with any kind of problems she may have, from colic to family planning or birth control. We also have our TB clinic when we have a doctor who comes up from Sacramento tuberculosis, yes, to do our tuberculosis clinics.
Is that still prevalent around here?
It's fairly prevalent, yes.
That's surprising. We're going to have to talk about that later on.
It's very interesting, yes.
So you dispense medications here too?
On a very limited basis, just through our clinic setting. Not anything of any great, like fluoride tablets for the children and birth control pills.
Now, when someone comes in here and needs to have a laboratory test done, a blood sample might be drawn here, or a culture might be taken of someone having a drainage or discharge or something like that. Where is that specimen sent after?
Most of those are done here in our
Right
laboratory.
here at the laboratory. Well, that's what I want to see next. So let's head over to the lab and see what that looks like.
Well, sure will.
Hi, Joel. It's good to see you again.
Thank you. Nice to see you.
I want to thank you for dropping off this interesting article at my office. I was fascinated to learn that in the laboratory here at the health department, not only are you doing the testing for different diseases, but you even do original research here.
Yes, this is not. This is the most unusual, especially for a small health department laboratory. But the opportunity presented itself due to the importation of malaria. And over a 4-year period, this paper was produced with the cooperation of the Center for Disease Control in Atlanta, Georgia.
I should make it clear to our viewers that you're the director. Mr. Joel Hornstein is the director of the laboratory here at the health department.
That's correct.
How long have you been here?
I've been here nearly 13 years. And in order to work in the public health laboratory, one must be a certified public health microbiologist.
Joel, tell us more about what's actually happening here at the laboratory.
The laboratory has a multitude of different functions. Among the most common things is the examination of specimens that are brought in from people who are thought to have or believed to have communicable diseases.
What are some of